Here in Rhode Island, Governor Gina Raimondo has given a detailed look at the next phase of reopening.
The governor says Rhode Island remains on course to enter phase 2 next week. This as the state's death toll gets closer to 700. Today, the Department of Health announcing the deaths of another 22 Rhode Islanders with a virus. 18 of them were in long-term care facilities. Now, the number of people in the hospital is up a bit from yesterday, but the governor says so far they are not seeing a spike since beginning phase 1 more than 2 weeks ago.
Among the things that will be allowed back in phase 2, youth sports. Eyewitness News politics editor Ted Nesi joins us live from the State House with the details. Ted?
Shannon, Mike, the governor says she's increasingly confident that coronavirus is under control in Rhode Island, and her goal is to keep it that way.
On Monday, when we start phase 2, there'll be many changes.
With the next phase of her reopening plan just around the corner, Governor Gina Raimondo used her daily briefing to lay out more regarding what's next.
We're going to be relaxing the rules around retail. More folks can go be in a store at any one time, allowing indoor dining, opening gyms, opening barbershops, salons, pretty much every area of the economy except for large group gatherings is going to start to reopen.
State officials posting new guidance for those industries throughout the day Thursday on reopeningri.com and hosting a series of Facebook town halls to field questions and complaints. Also Thursday, a significant policy change. Youth sports will be allowed to hold practices and scrimmages during June, and league and tournament games could be on the horizon for July if the state goes to phase 3.
So it means I do listen. Some of it was talking to a lot of people, a lot of coaches, athletic directors, parents who show us their plans and say, listen, trust us, we promise we'll keep these kids safe, we'll wear masks, won't share balls, we'll keep stable groups of 15.
With courts set to resume processing evictions on Monday, Raimondo said the state is allocating an additional $5 million to help Rhode Islanders make past due rent payments. She acknowledged that's only a Band-Aid on a bigger problem and says she's exploring how to create a mediation process.
But I don't think the right thing right now is to just put a lot of money into it, because what I worry about is you do that and it gets people to, the end of June, and then what?
But even as more and more attention is shifting to reopening, the virus continues to take a brutal toll on Rhode Island nursing homes, where the vast majority of Rhode Island deaths have happened. Coming up at 5:30, I asked the governor why those elder care facilities remain such a challenge. Live at the State House, Ted Nesi, Eyewitness News. Dozens of Rhode Island nursing home patients continue to die after contracting COVID-19, even as the overall number of Rhode Islanders hospitalized with the disease has fallen. Today, I asked the governor why the nursing home situation is proving so hard to get her arms around.
As soon as it gets into one, you're just finding it uncontrollable?
Infection control in these environments is incredibly difficult. You have some nursing homes where there's one bathroom for numerous people. They don't even have private bathrooms. It's a population that is older and frail and sicker. This virus is brutal on people with underlying health conditions and on people that are older and frail. A lot of times you have staff who work in more than one home. There's no one thing. It's like a perfect storm of, it's just really hard to control it. But we just haven't figured it out. It's not that it's lagging and we're on a much better trajectory. I don't want to say that. It's like the nature of the virus is such that it's, like I said, it's really brutal on the population who lives in a nursing home. When you live in a congregate care setting, and Rhode Island, as far as states go, we are overly dependent on nursing homes. The number of the percent of our system that's in a nursing home versus, say, home care is very high. Every day when you talk to the experts in Washington, they're on us by saying infection control needs to get better in nursing homes. And they're right, but there are some inherent limits when you have dozens of people who are sick, close together, sharing bathrooms, sharing rooms. It's not an excuse, it's just a reality. And so I think there's short-term things we can do, and I'm thinking about long-term, rebalancing.
And according to the Foundation for Research on Equal Opportunity, Rhode Island ranks 5th highest for the share of its nursing home patients who've died after contracting COVID-19. The only 4 states with higher numbers are New Jersey, Connecticut, Massachusetts, and Delaware. Live at the State House, Ted Nesi, Eyewitness News.